I'd like to welcome you to this webinar. This webinar is responding to mental health concerns in adults with intellectual disability. It's the culmination of a considerable amount of work which has taken place under very challenging circumstances. As we've all been experiencing across the world, the COVID-19 pandemic has not only challenged healthcare societies and also residential settings and other settings for people with intellectual disability. It's also challenged the conduct of research and the conduct of projects such as this, which have sought to hear the voices of people with intellectual disability and to ensure that they were contributing to their own health. So that's what this webinar is about. It's the first of 3 webinars, and it is addressing one part of this project. The project, as I said, is called SOOTHE. It's responding to mental health concerns in adults with intellectual disability. And today we're going to launch what's called the electronic quilt, a patchwork quilt or a collage of images which have been created by people with intellectual disability across 3 countries. My name is Fintan Sheeran, and I'm from the School of Nursing and Midwifery in Trinity College Dublin, where I'm Associate Professor in Intellectual Disability Nursing. I'm also the head of school in the Trinity College School of Nursing and Midwifery. And I'll introduce our other panelists in a couple of moments. But again, I just want to say welcome to people who have just joined us and to thank you for putting some time aside today to hear the voices of people with intellectual disabilities. In the webinar today, I will introduce you to the project that we've been undertaking throughout the last 12 months, though in reality throughout the last 4.5 months because of COVID-19. And I want to use this to highlight a creative and participative approach to supporting the voices of people with an intellectual disability. And these are voices that often aren't heard outside the context of those of us who provide service to them. I want to launch the SOOTHE eQuilt of mental health and well-being. And in the webinar, we'll also demonstrate that people with the intellectual disabilities understandings of mental health and well-being can be heard through the use of imagery. The plan is that we'll do the welcome and introductions, which I'm working through now, and I'll introduce the panel in the next slide, and I'll give them an opportunity to say hello as well, particularly in their languages, because I'm conscious that we have people here from Spain, we have people from Ireland, and we have people from Netherlands, and hopefully we have people from further afield as well. We'll explain the history of quilt making and the role that quilt making has played in supporting voices to be heard. And then we'll talk about how that has been used in the context of this piece of work. We'll present the quilt in its totality, but we'll also look at the apparent themes, the areas which seem to be receiving more attention in terms of the number of images which are covering particular ideas. We will talk about the experiences of engaging with people with intellectual disability. There are challenges to that, but there are particular challenges which we've experienced over the last period of time, which relate to the situation that we find ourselves in now. We will have understandings of mental health and well-being emerging from the images, and not only that, we will then have a discussion, and 2 of my colleagues here will lead that discussion about the mental health context for that. So when we see these images, how do they link in to our understanding of mental health and wellness in people with intellectual disability? And crucially, we will have contributions from 2 people with intellectual disability who submitted images, and they will talk about the images they submitted and what it meant to them in producing those images. And we will have time for questions and answers, and please keep your questions coming in. You can use the chat function for that, and we will be looking in the background at those questions, and we have time at the end to address the questions. So I'm going to introduce you to my colleagues, and I've introduced myself. My colleague, Dr. Carlos Peña Salazar from Parc Sanitari San Juan de Dios in Barcelona. Carlos, would you like to welcome the people in your own language, please? Your microphone is
Yeah,
off.
of course. Thank you very much, Fintan. Hola, buenos días. Muchas gracias por estar aquí hoy con nosotros. Como ha explicado el profesor Fintan, este es el primero de los webinars, de los seminarios que vamos a llevar a cabo dentro del proyecto SOOTHE. Esto es un proyecto europeo que iniciamos antes de la situación de pandemia, que lamentablemente estamos sufriendo todos y de una forma más destacada en los países del sur de Europa. Y bueno, pues es un proyecto muy interesante porque, como explicaba Fintan, pues pone la voz y el conocimiento en las personas con discapacidad, ¿no? Y no así en sus terapeutas. Entonces, en el seminario de hoy lo que vamos a explicar es la primera parte de este proyecto, que es el Work Package 1, o sea, el primer seminario, que está basado pues en el análisis y en la recogida de diferentes composiciones gráficas, dibujos, creaciones por parte de las personas con discapacidad intelectual, de diferentes servicios, de diferentes instituciones y de diferentes países. Y bueno, hemos obtenido mucha información sobre la comprensión de la salud mental y la capacidad de expresión a través del arte de las personas con discapacidad intelectual, y además creemos que ha sido una herramienta terapéutica pues, muy valorada por las personas con discapacidad. Iremos de alguna manera cambiando la lengua durante el seminario, pero la lengua vehicular será el inglés. Entonces, nuestra intervención después, que la haré con José Durán, será en castellano, pero al final veréis que haremos un pequeño resumen en inglés y nuestras diapositivas estarán también en inglés. Y ahora ya doy la palabra a Fintan. Thank you, Fintan. I'm finished. You can continue.
Thank you, Carlos. And joining Carlos from Barcelona is Jose Duran Salguero. Jose, do you want to say a quick hello?
Bueno, buenos días a todos. Bueno, un poquito también lo que ha explicado Carlos. Explicaremos un poco cómo ha sido la experiencia de esta primera parte de este proyecto. Y poco más que añadir, que muchas gracias a todos por estar aquí y por ver el trabajo que hemos hecho, y gracias a Fintan y al resto de equipos por participar aquí también. Muchas gracias.
Thank you. And as you're noticing now, there are going to be a number of languages in this session, but the primary language in the session will be English, but we will provide some facility for understanding in Spanish and Dutch as we progress through this. My next colleague is Professor Walter Pan from relation to University Medical College in Groningen and Hansa University of Applied Sciences in Groningen. And Walter, would you like to just say a quick hello, preferably in Dutch?
Thank you, Fintan. I will do that in Dutch. Iedereen in Nederland zeer van harte welkom bij dit webinar, georganiseerd vanuit Trinity College in samenwerking met instituten in Barcelona en de Hanse Hogeschool Groningen en het UMCG in Groningen. We gaan het vandaag hebben over een onderdeel van een project wat al langer loopt. Het gaat over het SOOTHE-project, waarin kunstwerken en quilts, zoals dat in het Engels heet, uiting geven aan wat mensen vinden, denken, willen, die zich specifiek kunnen uitdrukken via deze kunstwerken. En vandaag zullen we deze kunstwerken gaan bespreken. Ontzettend fijn dat jullie er allemaal zijn. Thank you, Fintan.
Thank you, Walter. And our last member of the panel today to introduce herself is Dr. Niamh Mulrine, who's Clinical Director in the Dorset Charity Disability Support Services in Dublin. Niamh.
Good morning to everybody, and particularly to those joining us outside of Ireland. I'm delighted to be part of this project. I think it's a wonderful opportunity for people with intellectual disability to talk about their experience of mental health and well-being, and to, particularly for today, is showing it through artistic means. And we'll discuss that as Fintan will guide us through the next hour of the webinar. Thank you.
Okay, thank you, Niamh, and thank you all. And it's a pleasure to have you present. And I look forward to, it's been great to work with you through the project, but I look forward to working with you through this webinar and through the two other webinars, which we'll tell you about towards the end of today's session. So I'm going to move forward with this. This activity is about people. And that's the key thing here, because so often people with intellectual disability are somewhat forgotten about in society. They exist often in different spaces to the rest of us. And so we have people who are congregated maybe in group houses or campus settings or hospitals. And often the integration of those people and their voice being heard is challenged by the situations they find themselves in. So this is about people. It's about bringing the control and independence for one's own mental health back to the people themselves, so that they have a voice, and also that they have some locus of control within themselves. It's an interesting thing to reflect on. When our panel went seeking funding for this project, one question which we were asked was, why should we be asking people with intellectual disability what mental health is? We all know what mental health is. What will they contribute? Underlying that question is centuries of people with intellectual disabilities' voices being not heard. We want to address that, making sure that they contribute from their experiences to our understandings of what mental health means for them. So it's individualization, it's person-centered approach. We brought together, as you can see, colleagues and people with intellectual disability from 3 countries. And you can see the partners on this. In Ireland, we've Trinity College Dublin and the Daughters of Charity Service working together. In Netherlands, you've got UMCG and HANSA, and a number of services who have linked in with us there as well. And then within Spain, we've had the Parc Sanitari San Juan de Dieu. And those of us in Ireland will be very familiar with the San Juan de Dieu, the St. John of God service, who have been providing service to people with intellectual disability in many countries for a long time. So this is a network of services working together, and of academics and of people with intellectual disability, working to understand mental health and wellness. We know the background, and I don't need to recount this background to you in any great detail, I'm sure, but we know that there are various levels of mental health, wellness, and mental, I don't like the word, but mental illness. So we all experience the stresses and the low moods and the anxiety of life. Sometimes that leads to effects on our moods and creates anxiety, significant anxiety symptoms. And sometimes those issues become so embedded in us that we need extra help. And so the level of support that's needed increases as the severity of the issues increase. And this is a prevalent problem for all of us in society. But we need to remember that there are 3 to 6 million people living with intellectual disability in the European Union. So this is a sizable group of people in the European Union, a sizable group of citizens who potentially have mental health issues, but who are also being exposed to the same mental health challenges that we get exposed to. But sometimes we have the opportunity to build coping mechanisms, and sometimes people with intellectual disability may not have that same ability. So we're trying to address this at a certain point. We're trying to deal with the everyday mental health stresses, challenges that people experience in their lives. And we know how significant they have been for so many people, particularly over the last number of months with COVID-19. When we started this project, there was no COVID-19 that we were aware of in this part of the world, in Europe. Everything changed in the last 10 months or so. And so that has been an interesting time as well for us to trace mental health and wellness amongst people with intellectual disability. And from a health service point of view, the costs become more significant as the level of mental unwellness becomes more significant. And from a health economic point of view too, it makes sense to try and prevent everyday mental health issues becoming embedded and becoming significant chronic issues for people. So this helps to maybe save money, but also to redirect that funding towards people being able to live lives which are fuller and which meet are more more in line with what they would choose to live themselves. So maybe we're able to free funding here in order to create better lives for people with intellectual disability. So the aim of this project was to engage with people, to listen, to hear a voice, and together to co-create solutions to maintaining good mental health and wellness. The project had a number of stages. We're not going to go through all this today, but I hope that you'll join us in the later webinars to look at Work Package 2 and Work Package 3 in particular. But our focus here is Work Package 1. But our aim here was to create a replicable program. Again, we'll talk about that in the next webinar, such that people would be able to take what we've done and recreate it or replicate it in their own situation, whether it's in another service or maybe in a community situation, such that we start developing that conversation and that awareness of mental health and wellness amongst people with intellectual disability. And in doing so, we want to disseminate that information to others so the voices are heard, so we learn. And that's what today is part of. This is the first stage of that dissemination. So the program feeds into the information we give out, and we intend then for that, for what we learn through our conversations and also through any replication of this program, we want to learn and continue to develop the program and make it better and better as we go forward. So we're focusing on the eQuilt. It's a strange concept, an eQuilt, an electronic quilt. For those who don't understand the term quilt, let me mention collage. Over the centuries, particularly women, they have made little cloth squares and sewed them together to make a cover for the bed. It's called a patchwork quilt. Yeah. So and in doing so, it became a way of women coming together, talking to each other, and starting to share their experiences. There are lots of other examples of that. For example, in sub-Saharan Africa, collecting water at the well is a place where, and has been a place where women meet and talk. But it's extended beyond that, so that we found mothers of people who died of HIV/AIDS starting to do patchwork quilts together, where they remembered their loved one, the person who had died. And it became a healing process. It became, in some cases, a human rights process. And back around 2011, we used this as an example, or as a technique for exploring human rights amongst people with intellectual disability in Ireland. And this is not the new quilt, but this is from 2011. It's called the Our Say, Our Rights quilt. It was the first time that an electronic quilt had been developed, to our knowledge, and it was published in the University of Missouri a book on quilting as an example of as the first example of an electronic quilt. On first glance, it's just a collection of images. But when you start looking at the images, you start seeing meaning. You start seeing similarities. You see the colors, but you also see words. And where there are no words, you start seeing themes. And you start understanding that there is meaning in the images that people with intellectual disability create. Not only we shouldn't only focus on the image, because to make that image, it's likely that the person engaged with somebody else, a carer, a family member, an advocacy worker, and that in that interaction, a discussion took place, in this case about human rights, but in our new project that we're presenting today, a discussion took place about mental health and well-being. That's interesting, because we've been working in our own societies outside of intellectual disability settings for quite a number of years to encourage people to talk about their mental health and wellness and well-being. It's linked into this idea of people taking control of their mental health and well-being. It's linked into the idea of recovery models, and it's linked into the idea that people must have a voice and must have a say in not only in the care that they receive, but also in the passion of life that they live. So what we've done here is very similar to what we have been doing elsewhere in society. We're creating spaces for people to think about mental health, to talk about mental health. And our hope is that as we progress beyond this year's project, that we can start to build communities of practice within the intellectual disability populations, such that people with intellectual disability become mental health champions and start to support other people with mental health challenges in the intellectual disability population, particularly those who maybe have more complex issues in relation to mobility and participation. So in the next slide, I'm going to show you the quilt that has emerged from this project. And again, it's a collection of images, and we will look at sub-grouping of those images in the following slides, so that we can actually get some idea of the themes which were emerging from this. From my point of view, this is quite emotional, because this is the culmination of a significant amount of work on the part of people with intellectual disability in a very challenging world situation. The images, again, are very small here, and you'll see them in the next slides, but we'll also have a slideshow which we'll show. It's about 4 minutes long, and you'll be able to see the images in there. It moves quickly, but we are recording this, and we will be making this available for people to look at afterwards as well. There were immediately some images which come out to us. There were images of hearts in there. I was amazed at the number of hearts. Now, immediately you might say, oh, they represent love. But in some cases, we can't see here, they have a line down the middle of them, which suggests that there's heartbreak. So we need to look in more detail at these as we go into it. There's images from nature. There's a lot of images, particularly from our colleagues and our participants in Spain, of masks. And I'm not sure, but maybe it relates to the experience of COVID-19 in our different countries. So maybe there's been different experiences for people, and we have seen that in society. Different countries have been affected in different ways. But to balance the COVID-19 issues, we have people also talking about the things that they want to do and they enjoy doing, the things which support mental health and well-being. We have images of nature, and often when we think about mental health and well-being, the connection with nature is often a positive healing connection. So I'm going to move through these and just show you we have a number of thematic areas which have come out of this. One relates to COVID-19 and wellness, and I've tried to link sort of two quilt sections together in these. We've got enjoyable activities, which covers things like getting out and about, and also doing things which we really enjoy doing. We have the links to nature in its many forms, whether it's images of flowers or trees, or the sea, or climbing our mountains, for example. We have a lot of images which come out in relation to people, whether they're individual presentations of the person themselves or people they know, or else they're images of people together. And in some cases, the narrative that was sent with these identified relationships which were loving relationships, family relationships, so that there's relationships seem to be, again, very important for people in this. Home and safety, this is something which I've seen before in previous quilt projects like this. The idea of having somewhere that you can call your own is often associated with security and safety and a grounding, or having a place where I feel I belong. And then there were many images which were colors and patterns, which it was difficult to, at this point, to interpret, but we will be doing further work looking at those. So the first two subsections I will show is the living with COVID-19, of which there were 33 images, and keeping well, of which there were 16 images. Again, you can see on the left-hand side, you see the masks, you see the visors, you see the images also of the the virus itself. And there's one image at the top right in there, which, if I remember correct, and I won't say the word on the video, but it's an expletive. It's an F word, and it says F COVID-19. So it's like the anger and the upset of what COVID-19 has done to people's lives. But on the other side, there are people who are also thinking about, how do we keep well at this time, and what can we do to keep well, and what do we need to focus on, and brain health. I suppose mental health, as using the image of the brain, came up a number of times. Pharmacy is there as well. Taking time out, reflecting, relaxing, finding joy in different things, eating well, feeling well. Those ideas come out in this as well. And I don't want to place too much interpretation on this, because if I try to interpret it, then it becomes my voice that's heard. So on the face of things, what we are presenting here are the voices of people with intellectual disability. The getting out and about and doing enjoyable things. I mean, these are the things which balance us often against the challenges and stresses which we experience. And maybe at this particular time, the getting out and about is an important thing, because so many people with intellectual disability, like other groups who have been defined as vulnerable, have found themselves closed in and found it difficult to get out, and their normal daily patterns have been significantly challenged. A lot of images of nature, and again, I don't think I need to say anything about this, but some images, as you can see, were photographs where people decided to photograph something which represented positive mental health, or something which would encourage positive mental health for them. People, faces, self. Again, some of these are individual. Most of these ones here are individual people. We don't know if they represent the person themselves always. Sometimes the images show faces which are happy, but sometimes they show faces that appear to be sad. Again, I'm not going to place that interpretation on it. All I can say is what I see. But family, friends, relationships, and loving and feeling loved. And the images of the hearts I mentioned are there. A lot of hearts, a lot of people together. Some words which talk about doing things together. We smile and laugh a lot, which suggests people are together. Hugging. And again, that's something which has been so challenging in recent times. We've just been told in Ireland that we shouldn't be hugging people at Christmas. So the idea of not hugging, that creation of distance and space between people, really challenges the I suppose the security and happiness that people, and wellness that people place within the context of their relationships. Home and feeling safe. Quite a number of images of houses, or of buildings, or of places which represent some type of home for people. And a lot of them are, I know when we draw pictures ourselves, often we draw an idealized version of our home. And it's a dream sometimes of the home, or it's a memory of home from before. And maybe it's an embellishment of how important home is to us. And then there are quite a number of colors and patterns, and we have narratives associated with some of these, but because we've had to compress this project from 12 months into five months, basically, the data for this only came back, and the images only came back last week. So what we're presenting are the images. The interpretation of the narratives that came with it will need a little bit more work. So these are the static images of the quilt, and I suppose at this point I'm going to ask. We will be looking at the mental health issues, but I'm going to ask maybe if Carlos or Jose would like to just maybe quickly just name those areas again, so people understand what they are representing. Do you need me to go back to the slides with the list, Carlos?
It could be okay, yeah.
Yeah. Okay. So I'll just go back to this slide here.
Thank you, Fintan. I'm going to translate a bit for Spanish colleagues, yeah? Ok, bueno, buenos días. Lo primero, disculparnos porque no hemos hecho una traducción simultánea, pero en 3 idiomas esto hubiera sido bastante complicado y de verdad que quisimos hacerlo, pero al final no pudo ser. Entonces, voy a intentar hacer un pequeño resumen de lo que ha estado explicando Fintan, ¿vale? Sobre el eQuilt. eQuilt sería lo que nosotros conocemos como un collage. Este collage está formado por diferentes dibujos, creaciones, fotografías que llevaron a cabo las personas con discapacidad intelectual que participaron en este proyecto. Creo que hay unos 350 dibujos y como digo, composiciones, y viene a representar lo que las personas con discapacidad intelectual entienden por salud mental y bienestar. Si hay alguna cosa que no completo o que crees que se tiene que ampliar, me cortas y me lo dices tú, José, ¿de acuerdo? ¿Vale? Porque José es el que ha estado más implicado en este proyecto, de hecho es la persona con Desiree y con otros compañeros que han llevado a cabo el VP1, ¿vale? Yo os lo pongo la voz y nada más. Entonces, bueno, lo que estaba explicando Fintan son las diferentes temáticas que han ido saliendo de estas composiciones que han ido realizando los participantes, los usuarios, y bueno, luego nosotros explicaremos más en detalle cuando hablemos tanto José como yo, cuando hablemos de la parte que hemos realizado aquí en Barcelona, en España, explicaremos un poco las diferencias que hemos observado, sobre todo en cuanto a la pandemia, ¿vale? Porque creemos que es un tema bastante particular las diferencias que hemos observado antes de que empezara la pandemia COVID, durante el confinamiento y después de la pandemia COVID, ¿vale? Y yo creo que con esto es un resumen suficiente, ¿no? ¿O que tú quieres ampliar alguna cosa más, José?
No, creo que prácticamente lo has explicado muy bien. Simplemente eso, ¿no? Nosotros sí que hemos visto esa diferencia a través de la pandemia del COVID, pero la clasificación que han hecho, porque ha hecho Fintan y su equipo, la verdad es que también está muy lograda, porque han podido clasificar los dibujos además por cosas que son realmente llamativas, ¿no? Y la verdad es que está muy bien. Yeah. Thank you.
Okay, thank you. And Walter, just briefly, if you could maybe just try to translate what those themes are, and if you want to say a few words about them, I just want to try and keep us to time as well. Thank you.
Thank you, Fintan. Yes, I will explain briefly the thematic areas in Dutch. De verschillende kunstwerken zijn gerubriceerd in verschillende thema's als een soort collage. En het is geen academische rubricering, het is geen wetenschappelijke rubricering. Het is eigenlijk een op het oog bij elkaar horende kunstwerken die een bepaald thema vertegenwoordigen. Een van de thema's is COVID-19 en gezondheid en je welzijn. Leuke dingen doen is een ander thema. Natuur, landschappen, bossen is een thema. Alles wat te maken heeft met mensen, relaties, geliefden, vriendschap is een thema. Thuis zijn, veiligheid is een thema. En kleuren en patronen. Fintan merkte op dat het allemaal gezien kan worden als echte, ware kunststukjes. En ze zouden een plaats in een museum kunnen hebben. Er spreekt veel creativiteit uit en ook er zit ook veel emotie in. Thank you, Fintan.
Okay, thank you, Walter. I have this feeling that we should have began this whole session with the Eurovision music and the Eurovision symbol, because it's always wonderful to hear the cultural diversity that there is across Europe and the language diversity, but it also speaks to the diversity which people with intellectual disability represent. We are all part of humanity, and so we are celebrating diversity here today. What we're going to do now is I'm going to pause my presentation here, and my colleagues are going to put a slideshow on, and the slideshow will be showing all of the images that we have so far with music behind in the background. So it's relatively it's emotional when you watch these, because there's beauty in there, but we need to understand the work that's gone on behind that. People have, as I mentioned before, have had to discuss these things. They've had to think about mental health and well-being. But you can see also there that some of the images maybe have been, people were maybe not able to make their own images, but they've been supported. So there's a lot of support work going on to ensure that the voices of people with intellectual disability have been heard here today. And I see some of the comments coming in, and the it's a sobering and humbling thing to see these, but it wasn't without its challenges. And I'm going to have a few words with Walter around the challenges that we've experienced. For the first challenge is, as I've mentioned, is this project was done in a difficult year for everybody. When we started putting this project together in 2019, everything looked possible. We would be able to meet people face to face. We'd be able to go in and talk to people and work with people. And we would have easy access in terms of communicating with services. But the realities of last February and last March and the months that have continued since then has meant that it's become almost impossible to move in and out of services, because that represented potential risk to the people who are living in services. And whilst Carlos and Jose have been working in those services on a day-to-day basis in Spain, we haven't been. I know even with Neve as clinical director, you found yourself on the edge of service as well. So we haven't been able to have the same amount of interaction. And that probably relates to the different numbers of images that have come back from different countries. You've had so much more interaction, I think, Carlos and Jose, in your countries. Walter, you found it quite challenging in Netherlands, didn't you?
Yes, we all did, and we had a good team of very engaged people who are affiliated to these institutions and with huge networks in this field. So, and still we were not fully able to get connected to the target group, so to say. And I think there are no significant differences between Ireland, Spain, and the Netherlands when we look to these facilities. We visited each other, and when we developed this program, this project, we were convinced that we were able to engage a lot of people, and there were a lot of positive vibes around it, and we did some pre-testings, and there was a lot of engagement as well. But to get connected in COVID period of time, there was a lot of anxiety. There were a lot of restrictions, safety restrictions, precautions, and nobody knew what COVID-19 was. And ICUs were, overloaded, so to say. So I can imagine that this happens. But as we are all here together talking about inclusion, it brought up new thoughts. So if it is in these difficult times so difficult to get together, to include people, I think especially in COVID-19 times, in pandemic times, we need to seek for possibilities to get connected and to go on, because I think the Quilt project must not be a project. It must be a kind of movement for people all over the world, and you can make quilts whenever, wherever you wanted to, and to give people the possibility and to support them to bring out their voices, to express their creativity in difficult times, I think we have to rethink about the difficulties we had in the future. So we learned a lot as well about this.
I think you've highlighted some really important things there, and I think one of the big challenges that those providing service to people and support to people with intellectual disability have had as well is that the pandemic has affected them, and there has been stress and there has been anxiety not only within the intellectual disability population but within the population of those who are supporting them. There's also been illness, and so there's been a lot of movement of and change of staff, and so the ability to support extra activities like this is something which may have not been possible in some situations, and we need to recognize that the challenges that people have experienced there. One of the risks that I've spoken about at an IACID webinar some months ago, one of the risks I see is that as we move forward towards next year, we have to ensure that in Ireland we call it the cocoon. We talk about cocooning. So older people, more vulnerable people cocoon. They close themselves away, and that's the principle that has been used in many countries to protect people. But we need to make sure that that cocoon doesn't become a solid structure, that it doesn't in any way bring us backwards in the history of the lives of people with intellectual disability. We need to ensure that we as the people who are working in the services and working with the services and supporting people, that we have to ensure that people do not remain cocooned and isolated. So having a project like this and similar projects allows for voices still to be heard. And I keep referring to voices, but it's a really important thing that people's voices are heard. The other thing which you mentioned about the idea of this continuing on, I'd like to see this becoming a living quilt, so that it doesn't just stop today. This quilt will be placed on the SOOTHE ID, SOOTHE.eu website, and we will be sharing that information later on. And my hope is that if more images come in, we start building it and building it and building it, and it becomes a continual place for the voices to be heard. So I think there are some challenges, but I think it's also useful. And we started a little bit late, and we're a little bit behind time, but I want to bring us back towards a discussion maybe on understanding what we've seen here and understanding what that means in terms of, say, mental health and also, let's say, mental illness or psychiatric illness. And does it tell us anything about the situation of mental health for people with intellectual disability at this particular point? Does it match with what we know from research and other literature? So to discuss this, Carlos and Niamh are going to, and Jose, I think, are going to discuss this together. Carlos is going to initially speak in Spanish, but he's going to synopsize in English, and then Niamh will take the conversation from there. And when we've had that, we hope to be able to have the contributions of some people who've submitted images. Just have to see how they're connected into this, and if we can connect them in to the video in this. So I'm going to hand it over to Carlos and Niamh.
Ok, José, puedes empezar tú, si te parece, ¿sí?
De acuerdo. Bueno, buenos días otra vez a todos. Me presento de nuevo. Mi nombre es José Durán, soy terapeuta ocupacional que trabajo aquí en Barcelona, en el Parc Sanitario San Juan de Dios. Junto a mí está el doctor Peña Salazar, que es psiquiatra y neurólogo, también trabaja conmigo aquí en San Juan de Dios, en el área de salud mental y discapacidad. Y bueno, vamos a explicaros un poco cuáles han sido nuestras experiencias en este Workpage 1, en esta primera parte del proyecto SOOTHE. Y bueno, adelante. El Workpage 1 da inicio en febrero de este año, de 2020. Previamente hicimos unas pequeñas reuniones con diferentes grupos que iban a participar en el proyecto para explicarles un poco, pues, en qué se basaba el proyecto y darle así pequeñas indicaciones para facilitar un poco lo que viene siendo esta primera etapa del proyecto. Recolectamos una gran cantidad de imágenes, de fotografías y de dibujos de diferentes participantes y de variadas organizaciones, pero la gran mayoría, pues bueno, fueron recogidas desde aquí, desde el parque sanitario, en las diferentes unidades que tiene el parque, y por plena inclusión de Castilla y León. Nos sorprendió mucho porque los participantes desde un inicio estuvieron muy comprometidos con el proyecto y disfrutaban mucho de esta actividad, ya que les permitía un espacio en el que poder dar salida a sus emociones y a sus sentimientos. Durante el desarrollo de esta primera etapa del Workpage 1, pues como todos sabéis, sufrimos la pandemia del COVID-19 y esto pues trajo diferentes problemas y trajo muchos cambios y experiencias que ni pensábamos que íbamos a llegar a vivir ni que sabíamos muy bien cómo lidiar con ellas, tanto nosotros como los participantes. Sus rutinas, su calidad de vida, pues como se tomaron unas medidas sociales muy restrictivas, se vieron muy afectadas. A pesar de ello, pudimos continuar de una manera bastante positiva con el Workpage 1 y con el proyecto, y pudimos ver cómo poco a poco esos dibujos iban sufriendo una influencia por parte de esta situación y que eran sustancialmente diferentes. Al final nos dimos cuenta de que esa influencia marcó claramente como tres etapas artísticas, podríamos decirle. La primera fue antes del COVID, que fue durante febrero hasta marzo y todo ello. Después lo que llamamos la época del confinamiento, que los chicos pues estuvieron en sus unidades sin poder salir, sin poder tener mucho contacto social con las familias, y tras ello, pues cuando ya permitieron ser un poco más flexibles y salir a la calle y todo lo que eso conllevaba.
Vale, bueno, pues como ha explicado José, se recogieron las composiciones pictográficas, las creaciones durante las tres etapas, ¿no? Antes del confinamiento, durante el confinamiento y entre la primera y la segunda ola, porque fue post-confinamiento, pero lamentablemente la segunda ola vino pronto, ¿no? Entonces sí que observamos algunas diferencias, ¿vale? O sea, en la etapa pre-COVID, las imágenes estaban muy relacionadas con experiencias pasadas, con necesidades materiales y físicas, y eran dibujos, pues como podéis ver aquí, más bien simples, lineales, en las que no había una elaboración muy precisa, ¿no? También se expresaba mucho acontecimientos pasados, o sea, recuerdos pasados, y cómo ellos habían sido capaces de superar estas situaciones negativas o traumáticas gracias al apoyo de una red social. Y la estabilidad emocional pues, es algo que también salía mucho a relucir como un factor clave para la salud mental y el bienestar emocional. Durante la época del confinamiento los dibujos cambian sustancialmente, se vuelven mucho más elaborados, mucho más intensos, utilizan colores también más intensos, empiezan a reflejar experiencias de añoranza hacia sus familiares, de libertad, de acontecimientos o de las vidas que habían tenido estas personas previamente a la pandemia. Y como digo, pues las emociones más habituales eran la tristeza y la desesperanza, ¿no? Y los dibujos, como digo, lo más interesante es esto, que cambian también en su composición. Después del confinamiento, en este pequeño lapsus que tuvimos de tranquilidad, pues los dibujos, una parte de ellos vuelven otra vez a tener un toque o unas características similares al preconfinamiento, pero algunos de ellos siguen teniendo unos tintes depresivos, ¿no? Lo que también cuadraría un poco con bueno, pues con lo que hemos observado en la clínica los psiquiatras y los psicólogos, ¿no? Que algunos de los pacientes en consulta pues todavía quedaban con unos tintes depresivos o adaptativos después de esta primera ola del confinamiento. A nivel de los resultados, son dos ideas a destacar. La primera de ellas es que realmente aprendimos mucho, como decía Fintan, ¿no? O sea, la voz en este proyecto está puesto en las personas con discapacidad intelectual y no los terapeutas, y aprendimos mucho sobre lo que ellos entendían como salud mental y cómo lo podían expresar a través del arte, ¿no? Y lo segundo de ellos, que fue, yo creo, muy útil y fue algo muy destacado, es que los pacientes y los usuarios, lo vivieron de una forma muy positiva y realmente vieron un beneficio terapéutico de este proyecto para ser capaz de llevar de una forma más adecuada esta situación de confinamiento, ¿no? A través de la expresión negativa de las emociones mediante los dibujos. Vale. Ahora voy a hacer un pequeño resumen de lo que hemos dicho en inglés para los compañeros, ¿vale? Que serán 3 minutos porque no tenemos más. Thank you, Fintan. I'm gonna carry out a short summarize of the most important ideas of our presentation. As you have seen, we have written every slide in English to make easier the understanding for our colleagues and our friends in other countries. But we think a couple of ideas we can highlight also. The most important is that we have collected a large number of pictures from different participants from different organizations and different countries. To collect these pictures, we have collected the majority of them here in our institution, and also Plena Inclusión Castilla y León have helped us so much. Then Plena Inclusión has also helped with the diffusion of this webinar, yeah, and we say thank you, yeah, for this. The second idea is that unfortunately COVID-19 pandemic happened, and that changed our lives and also lives of our participants. That means another well-being and another quality of life, of course. But we continue with the project, yeah, and the good thing that we can obtain of this circumstance is that we can see different characteristics of these pictures in these 3 different groups. Yeah, I mean, previous to COVID-19 pandemic, during the confinement, and after the confinement. I don't have time to explain in detail how were this difference in the characteristics of pictures, but I invite you to explore our eQuilt, yeah, and to see in detail the pictures that were made for different participants, yeah, because I think it's really interesting. And to close, I want to speak about our results. I think the most important is that we have learned so much from our participants, from people with intellectual disability, about the concept of mental health and well-being, and how they can express feelings and emotions through pictures. And I think that is really important because we learn so much. And the second thing is that this project was really therapeutic for people with intellectual disabilities during the confinement, yeah, and they rate that's really positive, and they say us that thanks for this project because we could express our negative feelings during this confinement, and that was really helpful for us. Okay, my time is gone. Thank you very much. I give you the word, and I give the word to Fintan.
Thanks, and I'll pass it to Niamh, and thank you for that. Niamh, you might want to respond to that and see if there are similarities as well.
Absolutely, thank you very much. It's been an amazing arrange and selection of pictures that have been submitted, and the interesting thing, as you've highlighted, is that this was done and arranged pre-COVID, yet it has absolutely influenced the output, not only the number, but also the quality, the themes that have emerged. 12 months ago, the themes of sort of kind of physical wellness, the COVID, the confinement just would not have been there. Okay, so while it has posed major challenges to the project, it has actually enriched it in other ways. So not only in actually bringing those themes out, but also, as Carlos said, in actually giving something which people could unite at a time when everything else was actually maybe more fractured and broken for them. And I think that's wonderful. And what emerges is a very strong picture of, despite the masks and the illness, that there's that hope, there's the colors, there's the light, there's the kind of the memory of good things and good things to come. And I think that's really important. I suppose from the point of view of the mental health and well-being, I think this is a natural experiment that no one wanted, the whole pandemic issue. It's not, nobody knew that we would have to deal with this year, but we have, and we are now hopefully in the next few months going to come to a much better place after it. For people with intellectual disability, it's been particularly difficult because of again, it's varied from country to country, but in many places there has been increased levels of confinement due to the excess of pre-existing medical conditions and due to other factors. From the point of view of, we know in the background that people with intellectual disability, as they age, they feel as vital and as energized as everybody else in the community, and certainly the Ideas Tilda project has shown that. That's one as a project based in Ireland looking at older people with intellectual disability. And we can see that coming through, that sense of positivity. And we also know, and this is very timely because only yesterday, Fintan, you're aware that Wave 4, the COVID report from Ideas Tilda was released, and it showed that the positive things from COVID was that over half people had some positive experiences. They learned something new. They had new activities. They got to know their staff better. They actually also had more time to chill, to relax. And we often forget that we are often in service so focused on being busy and keeping people engaged constantly that we forget that, just like ourselves, people sometimes like to put their feet up and chill a bit. And the great thing about this artistry project is that it's giving people a chance to reflect, to sit down. People aren't running around trying to go to 10 activities a day. They're sitting down and they're doing something that is very much reflective on where they are at the moment. I think that's very, very positive. I will be really curious to see how this grows from here, because I think there's an enormous potential to growth. I think certainly as services are reopening and more people are having more positive experiences in the coming months, I'm wondering what the 2021 pictures might look compared to the 2020 pictures and how those themes change over time. I think that'd be a really interesting thing to look back on and have a sort of retrospective view. So I think overall, I think it's been a wonderful project. I think that picture of hope and positivity, in spite this natural experiment that is happening in the background, is very encouraging for us all. And I really, really hope that people that have participated will continue to participate, and having this project across Europe in a number of countries. It's not just the 3 countries represented here today. There are people from other countries that have also contributed. I think it just shows that we're all one, we're all united, we're all in this together, and we can make something from it. The thought of having a webinar a year ago was something very alien to most people, but yet we are all here. This is like second nature to us today, and all the participants that have joined us today, many people, if you asked them a year ago about IT and engaging and doing video things, it would be really, really quite difficult. And even having access to the technology to do it would be difficult. So again, that's another positivity. So it's actually enabled this project. While it stifled it in some way for a number of months, it has actually also given a platform that's much, much more accessible to many, many more people. So that's another positive. So I think we need to roll with the positives and look forward to 2021.
Thank you, Niamh, and thank you, Carlos and Jose. And I think that you've actually highlighted something which I'll mention to those who are attending today. Next week, when we have our second webinar, we'll be looking at work package 2 and 3, and you'll see innovation. You'll see people using creative approaches to engage with each other in group work. One of the things we were quite amazed at was the ability of people with intellectual disability, particularly older people, to engage using technology. And so there's learning for all of us. Those of us in education situations where we're now teaching online, us running webinars and so on, we're learning how to use that. At the moment, we're probably using it too much, but as we move forward, this will become part of our normal approach. So and the other thing that I'd reflect on in terms of the meanings that are coming out here, when I look at what's coming out from people with intellectual disability, it's not really very different from what we're hearing people write about and talk about in our media, whether it's newspapers or on the radios. And why would it be any different? Because these are human beings experiencing similar types of things to other human beings. They respond in similar ways. So it's sort of, this reaffirms this concept that I mentioned earlier on of diversity, and that is very much part of what's in the UN Convention, as you know, on the rights of people with disabilities. We are people who experience disability are part of the diversity of humanity. So I'm eager that we also of contributions from people who submitted quilt squares. And my understanding is there are 2 people in Barcelona who are going to speak to us now, and they will be speaking in Spanish, but maybe Carlos or Jose can translate at the end of it just a few words about what they have said. Carlos, are they ready to take part?
Yeah, you can start, Jose, if you want.
Yeah, I want to start. Bueno, os presento primero, antes de todo, ellas son Miriam y Cristina. Son 2 chicas que han participado en el proyecto y en la primera parte, en el Workpage 1, ¿vale? Y nos van a explicar un poco su experiencia, nos van a explicar un poco sus dibujos, nos los mostrarán y nos enseñarán qué representan para ellos y por qué lo dibujaron. Y bueno, os dejo con ellas, empezará Miriam, ¿de acuerdo?
Hola, me llamo Miriam y este es mi dibujo. El mar para mí representa la vida, el vaivén de las olas, su fluidez. Esa brisa que trae cosas de lejos. Me hace recordar momentos con mi madre y mi hermana en un barco, disfrutando de ellas y de esos momentos tan bonitos. Cuando me imagino mirando el mar allí de pie, notando la arena húmeda entre mis dedos, es como si todos mis problemas se quedasen a un lado durante unos segundos. La brisa golpeando mi cara trayéndome energías renovadas para afrontar lo que venga. Siento que esa sensación me abraza y me acoge al igual que hace mi madre y mi hermana. Esa paz y esa tranquilidad es lo que yo entiendo como bienestar.
Ahora Cristina nos explicará el suyo y nos lo mostrará. No sé si se ve, Cristina. Ahí.
Ahora. Hola, me llamo Cristina y este es mi dibujo. En este dibujo intento explicar la importancia que tiene mi familia durante todo el proceso de mi enfermedad, desde el diagnóstico hasta hoy. En un inicio, mi enfermedad ocasionó que me distanciara de ellos. Ellos apoyaron en mi recuperación. Mi corazón está formado por su cariño y su comprensión. Ellos hacen que esté bien. Me di cuenta de lo valioso de tener a una familia y sentir parte de ella. Durante mucho tiempo no me sentí parte de ella y ahora ellos forman mi corazón, el que me da valor para seguir día a día y mantener saludable y bien, amor, unidad. Mientras hice el dibujo sentí tristeza. El confinamiento me ha hecho sentir de nuevo que formó parte de mi familia y que no podría verlos. Participar en este proyecto ha sido bueno porque me ha permitido expresar cosas que sentía guardadas dentro y que me costaba ocasiones compartir con otros. Gracias.
Carlos, ¿haces tú la traducción? ¿La hago yo?
Si la tienes tú preparada, puedes hacerla tú.
Bueno. Miriam says that the sea is the meaning of life. The waves, the movement, the breeze of the sea in her face, all of that makes her feeling alive. She remembers having a good time when she was on the boat with her family, and she imagines how good it would be standing on her feet, feeling the sun between her toes. That moment represents a peaceful time to her. Cristina talks about the importance of family, being with her in this moment of her life. Her family supported her from the very first moment when she got the first admission until today. Even she didn't feel she was part of the family due to her behavior. During the COVID-19 lockdown, she felt that way again, but thanks to this project, she is able to express her emotions and share them with all us. Thank you so much. Gracias.
Gracias, Miriam y Cristina. Thank you for taking part, and thank you for explaining your pictures. Gracias.
Muchas gracias, Cristina y Miriam.
Okay, so we had sought to get people from Netherlands and from Ireland to speak, but the nature of this was that in our countries this was done as an anonymous survey, so it was very hard actually to go back and to go directly to people to invite them. But this is something that we may do as we move forward, because I think whilst this was part of a research project, there is a social action aspect to this as well, and there is maybe a need for us to move it to the level of continued social action and therapeutics. So I think what we've heard here today I think has been very positive. I think it's the beginning of something as opposed to the end of something. And there are some questions which have been coming up through the chat. A lot of comments and people who have said how wonderful the images are, and how wonderful it is for the voices of people with intellectual disability to be heard. So I'm working from a screen here, and I want to just see if we can go through a number of these questions. Mark asked a question, do we think that people with disabilities and mental health conditions should be given a chance to get paid employment if they wish to have paid employment? Niamh, do you want to say anything on that?
Yes, thanks, Mark, for your question. The answer is absolutely. For any of us, whether we have a disability or not, we have a right to get to be employment and to be supported. And in fact, the ERCPD actually supports that, and it states that countries should support systems and put systems in place to allow people with disabilities enter the workforce and to be supported while they're in the workforce. So absolutely. So I think not only is there the issue of supporting people who have good mental health, and if their mental health is suffering for various reasons, that they can get support, but also that having employment and having paid employment is particularly important. And it's something that has been quite slow in some countries, I think, to come through, but it's something that absolutely people have a right to get if that's what they want. And we, as service providers and as organisations, need to advocate and support that standpoint.
I think what we see is work is essential. It has a central role in people's lives. It's not just about economics and sustaining your life from an economic point of view. Many of us are finding now during COVID-19, especially, I can speak for as an academic and a researcher, I have not been in my office for 6 months. More than 6 months. I haven't seen my colleagues and met my colleagues for so long, and there's community within the workplace for many of us, and there's meaning there as well. So meaningful activity, network, and we know also from the work of IDS Tilde how important the relationship network is to people with intellectual disability. Something I meant to mention earlier on is that when we saw all the images about of people and connection to other people, we have found out before, and other studies have done similar. They found out that when people with intellectual disability have changes in their network, and especially their network of support, they experience considerable anxiety and stress. COVID-19 has been a situation where we've been disconnected from our networks, but people with intellectual disabilities networks have been upset as well. So the workplace network is a really important one, and I think Niamh has spoken to that. I know that Raquel, I hope I'm pronouncing that, she said, muy interesante, gracias. I don't speak Spanish, so excuse me. She said, for sure, the pictures that they've made can say many things that words can't, and could help us to hear people more and give them the adequate support that they want. Do we agree? And I don't know if Carlos or Jose want to respond to that.
Right. Yeah, thank you, Fintan. Yeah, I think the project was really helpful for people with intellectual disability to learn to express feelings and emotions. And despite of the terrible situation that we live and we are living in Spain now, with so much restrictions, and everybody is out of their previous life. I think these kind of projects help to people to continue a bit with their lives and to see a positive think, yeah, and to overcome difficult situations. And of course, this situation is terrible for everybody, and especially for people with intellectual disability. And also because here in Spain, these restrictions are more severe in residencies and for people with ID and for all people, because we try to protect them from the infection from COVID-19. That makes that these social restrictions are really hard. Yeah, and we know that this moment is really hard for them. Because of that, I think we have to continue working on this way and to promote some kind of projects like this.
Okay, thank you. I'm just conscious of that. We've only got a number of minutes left. I just want to respond to some of the other questions that are there, which I think I can respond to quite quickly. Helena had asked, she said it's an amazing project, and she asked had participants also expressed their feelings about being part of the project. I think that has come through in the presentation from our Spanish colleagues, where people felt that this had been a therapeutic thing for them. It had been an opportunity for them to express their emotions and their feelings. So it would be interesting to see what effect that has over a period of time in people's lives, but that wasn't the aim of this project at this time. It may be something that we would look at as we move forward to see, do these activities actually lead to do they help people to be able to support themselves and provide maybe one coping strategy for people. I know Pauline has identified, she's a registered nurse in intellectual disabilities, which is a type of nursing that we have in Ireland and in the UK in particular, and it was in Netherlands before. She said she doesn't feel enough is always done regarding mental health for people with intellectual disability. And is there anything that can be introduced to services to highlight this and raise awareness of the issues? I think the engagement of services in projects such as this increases that awareness, and that's one of the aims of this, as I mentioned earlier on, is to stimulate conversation, to stimulate discussion, so that it becomes okay for people to talk about mental health. Mental health and mental illness are not an integral part of intellectual disability. They happen to people with intellectual disability, but they also happen to people without intellectual disability. So we have to look at what are the things which contribute to mental health problems for people with intellectual disability, and at what level we can act. And if you remember the earlier part of my presentation, there are a number of levels where we can act. If we can act early, we may be able to reduce, for some people, the effect of mental health problems in their lives as they progress. So I would be hopeful, because I've a number of, in Ireland anyway, a number of services have come to me and said they want to do this work next year. So I'm hopeful that we will be able to continue this work, not only in Netherlands, Ireland and Spain, but also to expand this to other countries. And I have colleagues in Boston, in Massachusetts, who are interested in this area as well. The challenges of engaging people with complex needs, Sally has asked, especially those who are non-verbal, how did you engage them, their families and professional carers? So I'm going to ask I don't know, Jose, if you would be able to help us with this, just very briefly. So the question is, how did we engage with our work with families and professional carers of those people who had very complex needs, and particularly those who did not speak?
La pregunta es, ¿cómo trabajas con personas que no tienen capacidad verbal y con necesidades complejas, y cómo les damos un soporte desde nuestro trabajo a ellos y a sus familias? Si quieres me lo explicas en castellano y yo lo traduzco.
Perfecto. Tratamos de encontrar...
Wait. Fintan, he's gonna explain that in Spanish and then I can translate, okay? Yeah.
Tratamos de encontrar algún sistema de comunicación, sea visual o a partir de la imitación en muchas ocasiones, para poder conseguir llegar a ellos. Una vez hemos conseguido esa primera parte, que es llegar a tener una comunicación simple con ellos, ayudamos a que realicen cualquier tipo de actividad, en este caso pues sería participar en este proyecto, a través de la imitación. Ponerlo junto a él, explicarle. Es difícil explicar lo que es la salud mental, pero sí podemos conseguir explicar qué es lo que a él le hace sentirse bien, porque podemos intuirlo al ver qué es lo que él busca, cuáles son sus necesidades, y a partir de ahí podemos trabajar y encontrar una respuesta que sea la más adecuada. Con las familias, un poco lo mismo, ¿no? A través de la comprensión, con ellos no tendremos tantos problemas a nivel comunicativos, pero ellos pueden ayudarnos mucho a comprender al usuario y de esa manera llegar a él lo antes posible y facilitarle lo mejor lo que podamos. No sé si he respondido bien a todo. Pero...
Yeah, I'm going to translate. Jose said that with people without verbal communication, we try to understand these people and to communicate with them through other mechanisms and not with verbal production. Yeah? And we use so much the imitation, and we try to explain them what probably they have some difficulties to understand what mental health means, but they can understand what makes to feel happy and to feel comfortable. We work in this way. And then with families, it's easier, of course, but I mean, the most important is that the participants without verbal communication can understand what makes positive for them and what makes negative for them. Yeah, and then we explain what we achieve with participants or with patients in our inpatient unit to relatives.
Okay, no, thank you for that, and I appreciate that. I'm just going to finish on with this. There are just two more questions which I'll try and respond to myself. I'm sharing my screen because I want people to be aware that there are two more webinars, and there's information on them there. If you go to the SOOTHE.id.eu website, you'll get information there, and I think that's been shared in the chat as well. Mairead was asking how we can best support family members with intellectual disability who are shielding or cocooning at home to protect their mental health. I think some of the approaches that we're using and we've been suggesting, these artistic approaches, are very easy things for us to do in our interactions with people with intellectual disability. They provide an outlet, they provide some normality of activity, but they also help to help maybe for people to explore emotion and mental health. And Lawrence had asked a question about whether we need specialized intellectual disability nurses with mental health specialty to provide access to mental health services. That's a contentious issue, which is maybe for another day, but it depends on the mental health services in any situation, in any country or any locality, and it also depends on how accessible they are to people with intellectual disability in terms of their ability to respond to the needs of that group of people. It's 11:30 and we are going to finish now, and I said we'd finish on time. I want to thank so many people for being here. I know we've had more than 130 people attending today. I want to thank my colleagues, Walter, Neve, Carlos, Jose. I also want to thank Michael and Eddie, who've been in the background, but there's more people involved in this team, and there's also the people who contributed their pictures. We wouldn't be doing this work if we didn't believe in people with intellectual disability, and we wouldn't be presenting this work if people with intellectual disability didn't believe that this was something which was worthwhile for them to do. So we're really grateful to them, and I hope my colleagues will pass our thanks and our appreciation to the people who they know have supplied images for this. There are two more webinars. Please don't forget about those, because whilst we focused on one area here, next week we're going to look at what the group work around meaning of mental health, exploring that further in the lives of people with intellectual disability, what innovations people naturally use to achieve good mental health, and what we can do from a technology and non-technology approach to support them. We will have Learnovate from Trinity College involved in that, and we'll have our colleagues again from San Juan de Dieu and from Netherlands engaged in that session. And our final webinar will be bringing together understanding of what have we learned? What do we know now that we didn't know before? What have people with intellectual disability taught us? So please join us for those 2 webinars. Thank you again for your engagement today, and I look forward to seeing you at some stage next week. Can I just say one last thing? The webinar is being recorded and will be available online and that will be notified to all people who have participated and registered. And also the slideshow will be made available as a YouTube slideshow, and that will be communication to people as well. So thank you. Have a good day. I look forward to seeing you again soon.